I don't know of any other circumstance where we sanction the killing of one person to make another person's life easier. And that's what we're doing in abortion. My name is Dr. Kathi Aultman, and I used to do abortions. When I entered medical school and then residency, I felt very strongly that abortion was a woman's right. And I was very pro-woman and wanted to do everything that I could to help women. So when it came time to learn abortions, I not only learned the D&C abortions, which was standard for the time, but I also went and got extra training to learn how to do D&E abortions or dismemberment abortions. I didn't see the human fetus as any different from the chick embryos that I dissected in college. I didn't see them as little people. I just saw them as medical specimens. And so I actually enjoyed sending the parts down to pathology, and then later enjoyed reviewing the slides to see how everything was at a microscopic level. I didn't see them as human beings. During my residency, I needed to moonlight to make extra money, and I chose to do that by working at an abortion clinic rather than an emergency room. Part of that decision was based on the fact that I could make more money at the abortion clinic, and I thought, frankly, it was easier. Now, it's a painful procedure, so I couldn't make it entirely pain-free, but I tried my best. I never even considered what the fetus was feeling, what the baby was feeling. I was so pro-abortion that I continued to do abortions even when I was pregnant, and I saw no inconsistency with that. My baby was wanted and theirs was not, and so I had no problem doing their abortions. The problem came after I delivered my baby and went back to the clinic for the first time. Somehow during that experience, I must have made the baby fetus connection. And so I reacted differently when I returned to the clinic than I had before. And I ran into 3 patients there that changed my mind. The first one had used abortion as birth control, and I realized that I personally had done 3 previous abortions on her. I went to the clinic staff and told them that I didn't want to do the abortion, that she was just using it for birth control. And they said that I didn't have the right to make that decision. That was her choice, and I had to do the abortion. I looked at them and I said, "That's easy for you to say. You're not doing the killing." But I did the abortion, and of course she did not want to use birth control afterwards. The next patient came in with a friend, and the friend asked her at the end of the procedure if she wanted to see the tissue. And she said, "No, I just want to kill it." And I thought, what did this baby ever do to you? Now, those 2 responses are not responses I would have made previously. So something had changed in my mind, that I was thinking of these fetuses more as babies. The third patient was a woman who had 4 children, and she and her husband had decided that they just couldn't afford another. She cried the entire time she was at the clinic. And I think that the apathy of the first patient and the hostility of the second patient, compared to the abject misery of the third patient, who knew what it was to have a child, made me realize that I could not continue to kill these babies just because they weren't wanted. The sad thing is that although I couldn't personally stomach doing abortions anymore, I still believed abortion was a woman's right, and I still referred for abortions. My thinking on that didn't change even after I became a Christian. However, there were things that happened in my practice that began to put a chink in that armor that I had. One of the things was that in my church, there were several unplanned pregnancies, and these mothers chose to keep their babies. And one of them was a Down syndrome child. As I watched these marvelous young people grow up, I realized that if they had been aborted, they wouldn't be here. I also strongly believed that an unplanned pregnancy was the worst thing that could happen to a young woman. But that's not what I saw in my practice. I saw young women with unplanned pregnancies who did extremely well. Their families gathered around them. There was support available, even if they didn't have a strong family system. And these young women did well. Then I was seeing other young women, highly educated women, who had made the decision to abort, but were dealing with the psychological and physical complications from abortion. One woman told me that when she got pregnant, her knee-jerk reaction was to have an abortion because it just wasn't the right timing for her. However, after she had the abortion, she ended up having to see a psychiatrist because the realization that she had killed her child was devastating to her, so much more devastating than the idea that she was pregnant had been. I had another woman who came to me for continued pain and bleeding, who had had an abortion at 20 plus weeks. It was a medical induction abortion, and after being in labor overnight, she was finally told to sit on the toilet and push. She delivered a baby boy into the toilet, where the baby then drowned. I don't know that that young woman is ever going to recover from the trauma from that abortion. I made friends with some Christians and joined a group of single Christians who accepted me for who I was and understood my position on abortion and yet didn't judge me. After we had been friends for quite a while, one of them was finally brave enough to come to me and say, "Kathi, I know your position on abortion, but would you consider reading this article?" And I said, "Sure." To give you some background, my father was with the unit that liberated the first concentration camp during World War II. And so I grew up with all those pictures and stories. And when I became a physician, I couldn't understand how German physicians could do the things that they did. The article compared abortion to the Holocaust. And I suddenly realized how those German physicians could do what they did. It was the same reason I could do what I did, and that was we did not consider our victims as human beings. And for the first time, I saw myself as a mass murderer. That was when I became pro-life. And it took a lot of prayer and healing for me to finally recover from that shock and trauma. I subsequently ended up testifying throughout the country and in different states, and actually testifying in court on the partial birth abortion ban, and eventually before Congress. It was interesting that During the filming of Faces of Choice, I had the opportunity to meet some of the survivors of abortion. And one of the women, Jennifer, when she first saw me, she said, "I forgive you." Those are the very first words out of her mouth. And I thought that was really nice of her and didn't think too much more about it. As she was giving her testimony, I started crying. And my heart just sank because her mother underwent a D&C abortion, but the head was too large, or that was what the doctor told her mother, that her head was too large and he couldn't complete the abortion. And so he sent her home, told her she would miscarry. Afterwards, I looked at Jennifer and I said, "Jennifer, I'm so thankful that I was not your mother's abortionist, because had I been, you would not be here. Because I had the tools and the know-how to complete the abortion." And suddenly the one thing that I was still sort of proud about, the fact that I had saved this woman from having to go to the hospital, possibly getting infected and having all kinds of problems, from having an abortion that I couldn't complete, suddenly I felt that was no longer anything to be proud of. The media has been very successful portraying the plight of the young woman or older woman who has an unplanned pregnancy. And we are very sympathetic to that, and we should be. However, in the course of that, we have completely forgotten about the other person involved, and that's the baby. We all have rights. We all have choices. And we have become so focused on the right of a woman to reproductive freedom that we have completely forgotten about this other person and their right to life. I don't know any other circumstance in which we sanction the killing of one person to help make another person's life easier. We all have choices, and I remember making a choice that I regret to this day. I had just graduated college. I was working as a high school teacher at a parochial school. I had my car. I felt on top of the world, and I was driving in the backwoods of New Jersey when God asked me a question. I don't remember exactly what he asked me, but I remember my answer, and it was, "Well, I don't want to give my life to Christ right now because I want to have some fun first." Wasn't long after I met my future husband. We had sex and I got pregnant. And I was afraid that if I continued the pregnancy, I wouldn't be able to go to medical school. I was also afraid of what people would think about me. And I thought that if I got married because I was pregnant, my marriage would end in divorce. I later met women in medical school who had had their children first and then gone to medical school. I realized that people who were really my friends would have continued to support me, and my marriage ended in divorce anyway. So that none of the reasons I had for having an abortion were valid. I wish that when I was faced with that unplanned pregnancy, that abortion hadn't been so easy to get, that I would have been forced to take some time to consider my decision, which affected me the rest of my life, which I still regret. You have the choice to adopt. You have the choice to parent. Don't make the choice that is going to kill your baby and something that you will regret the rest of your life.